September is Suicide Awareness Month, and so I kind of wanted to start off by talking about the state of mental health services on campus. Last semester, the Lantern obtained an internal email from CCS detailing a preferential treatment policy, in which if a student shows up to CCS with a parent or professor, the email said they get priority treatment. So I was just wondering, as president of the university, what you say to a parent whose child doesn't have that kind of support on campus.
Well, none of our health services, our health services should be triaged based on the needs of the patients, period. End of sentence, period. No other thing is appropriate. So end of sentence, period.
Mm-hmm. So then was there kind of a response at the university level when that kind of, even if it's, not officially the policy, if that was kind of the policy in practice, what was the response?
So I don't know that would have been the policy or practice. I mean, I wouldn't have heard that was the policy or practice. I did hear of that then, and we said, that, again, that prioritization for patients is based on patient need, period.
Mm-hmm. Mm-hmm. So I guess just, has there been kind of a checkup to see that it is going by patient need now?
I haven't followed again to see that there's been anything different than that, but this was something that would have been outside policy and procedure, and this patient services are based on patient need. Mm-hmm. Period.
Yeah. Mm-hmm. So kind of pivoting a little bit to the Suicide and Mental Health Task Force there. So we know that the task force is making resources more visible. We know that they've been working towards a partnership with Headspace.
Yes.
Yes. So what can we expect to see next in terms of implementation from the task force?
A couple things. First is that we were pleased at the work of the task force. We brought together students, faculty, and staff, and then they brought to the table people from a wide variety of disciplines to share all of the things that were going on campus, the things that were available to our students and to our faculty and staff. And suicide was a part of their focus, but also mental health services broadly were part of their focus. And we wanted to take an inventory of what we had and then do things that we could to be as effective as possible. We found a couple of things. First is we found that we had pretty much the entire range of services that exist. Not 100% of everything that everyone had, but pretty much the full range of services. And that goes to, a full-service inpatient mental health hospital on campus, which is just an unusual thing to have, then down to a variety of counseling services and multiple other interactions down to peer support groups and just a great range. But that the coordination of those and alignment of those was not optimal. Many of the services had been established or modified in response to new knowledge or information or particular need, and not always in total coordination with everything else. So Program B might change, and that might affect Program C, but Program C wouldn't know that Program B had changed, et cetera. So a big thing that they did was to help to inventory those services that we had and to see how we could do a better job of aligning them and then making them available to students and others in a way that was effective. So they came with a series of recommendations, and we then took the recommendations and immediately turned from a review task force to an implementation task force, because we didn't want a series of recommendations that just sat and were good recommendations but weren't a change in policy. And we then began to work on implementing those changes. Some were done a year ago, last fall. We made a series of changes that I think were very important and are a change in policy going forward. Others, I think that the, what's it called, the warm line? I call it the warm line.
Is it the peer-to-peer?
I think it starts today, in fact. So I think it goes live today. So that was another recommendation that came from the committee, and the idea was to go through all of them and to do what we could to move them all forward. The Headspace app, I know I get recommendations for them multiple times a day, and so we want to use what's available, get data from what we use to see how we can do the best we can to make ours the safest and healthiest community possible, and it's an ongoing issue, as you know, that affects the entire country, but we want to continue to do what we can to be as effective as possible.
Are there any implementations we can expect to see this semester specifically?
Well, today.
Oh, right. Great point.
Tonight, the peer-to-peer one. And then I'd say that's the one that I know of that's coming up right now. That was the biggest one that's coming up right now. There were some things done last year and will continue this fall to help campus safety. And there are a multitude of those things that are done. Those are, those aren't things that you see so much, but I will say that at the end of them, then the campus will be specifically safer in ways that I believe will be meaningful and material.
So just to clarify what you said, it's kind of more of the behind-the-scenes work that's not as visible.
Those things are more structural and behind the scenes, and we do those things to make the campus safer. And we tend not to want to focus too much on what they are. We'd rather do the things to make the campus safer, if I can say it that way. And so we've begun that work already and are pleased that it's moving along, and I think it's a very important thing to do.
And do you mean safer in terms of like mental health specifically and
yes.
suicide prevention specifically?
Yes, specifically. And we want to be the safest place that we can be. There's yeah, we just want to be we want to have our environment be the safest that it can be, and so things that I believe and we believe we can do to make the campus safer, and we've begun that work already and are continuing that work very actively, and I feel very good about that.
Are there any kind of examples of that you could share with us?
Let me tell you why I wouldn't want to. They're done to help reduce the chance that someone might do something that hurts himself or herself. So it's not in our interest to focus too much on what those are, because we don't want to. Does that make sense?
Yeah.
I mean,
you're not trying to offer ways for people to get around those things.
For example, yeah. I know this is very close to my heart, and I grew up in a family of psychiatrists. My father was a psychiatrist. My father's pictures up there. A psychiatrist. My older brother, a psychiatrist, and so it's something that I've watched for decades, and on this campus and other places I've been, and so we want to do everything we can to make the campus as safe as we can, and we want to be the safest possible environment for our students. So let me just say we're working to do those kinds of things. Let me pivot a bit and go to things like the peer-to-peer counseling line. So that's something that we've initiated to try to also be very visible in outreach. We've worked on the apps that you've seen to try to have there be more opportunities. The mental health, have been working on a mental health app as a part of our work with Apple and others to try to make it possible for people, easier for people to get the support that they need. We're also working with Bern Melnick, who is our Chief Wellness Officer. I think that I want to say her title wrong. If I say it wrong, then someone will feel that there's been a promotion, or I don't want. So she's Dean of our College of Nursing, but she also has an overall campus position as our Chief Wellness Officer, and she's working on a series of ways that we can support in our broad health services, that we can support students, faculty, and staff even more. So we're looking at best practices in screening when people come in for exams, et cetera, and that's an ongoing process of improvement. So those things are all happening.
Yeah. You also mentioned that faculty and staff make up the Suicide and Mental Health Task Force, and I know that Dr. J was the co-chair of this,
yes.
And I know that obviously she's moved on.
Yes.
So as you're searching for her replacement, I'm just wondering if is the Suicide and Mental Health Task Force something that you're keeping in mind as you're looking for her replacement?
Yeah, so I would just say mental health is an extraordinarily important, top-of-mind issue for us all the time. When I've been here now, this is my 6th year. When I arrived, one of the first things we did was look at the services that we had, and we dramatically increased the number of people that we had on campus and did our best to get the throughput moving even better. There's still work to be done there. As you know, the demand keeps rising nationally. But we've been working on this year after year, continuing to try to do the best we can to make this a supportive environment. And the new Senior Vice President for Student Life will be someone who needs to be very concerned about that.